Tonight, both Desert Regional and JFK Memorial Hospitals are treating the highest number of coronavirus patients since the pandemic began, and doctors are preparing for those numbers to climb. I spoke today with the medical director of emergency operations, Dr. McCafferty. Dr. McCafferty, thanks for joining us.
Thank you for having me today, Peter.
How are things right now at both Desert Regional and JFK hospitals?
Well, certainly over the last several weeks, at both hospitals and across the county, we are seeing an uptick in the number of COVID cases. As of this morning, Desert Regional Medical Center has 77 patients and JFK has 30, and then an additional 25 between the two that are still under investigation. And those are the highest numbers we've seen in the course of the last 4 months.
Yeah, that graph you sent us, it shows that this is the highest number you've had in the last 4 months. Are you concerned the numbers are going to climb?
Right now, the predictions are that over the next several weeks, up into early to mid-August, we're anticipating cases across the county to potentially approach 750, whereas they're roughly at around 500 right now. So we are absolutely prepared and expecting there to be a continued rise, that we are continuing to work diligently in the Desert Care Network to address the needs of those patients as well as the other healthcare needs of the community.
What are some of the trends you're seeing with coronavirus patients?
Well, specifically, there's an uptick, certainly. There's an increase in the positivity rate that we're seeing overall. What that means is a little uncertain, but we do know that there's an increased patient census across the county. We are seeing a slight increase in the median, or decrease in the median age, and an increase in those that are slightly younger, whereas previously it was almost exclusively elderly patients that were getting hospitalized. Overall, the median age has dropped slightly in the county and at our hospital. We are operating at the high level of our capacity that we might see in the winter months or during the high season. The added challenge of addressing it specifically to COVID patients we've been preparing for 4 months. So we are adequately addressing the current surge. The challenge really that we're facing is this is sustained. Typically during the winter months, there are fluctuations that last days or weeks, and we address those fluctuations and then they go away. This is causing a lot of stress on our system and our healthcare workers.
How is the staff doing right now at both hospitals?
The staff is doing as well as can be expected. Make no mistake, this surge is causing a stress on our healthcare system and our healthcare workers. That said, my perception is that the individuals that come to work every day are proud of the efforts that they are providing to the community. If I may, I'll give you a slight anecdote. I have a patient that is an employee of Desert Regional who I had to take out of work for an injury unrelated to COVID. I just saw him the other day. His attitude when I talked to him about returning to work was, and I'll paraphrase, I really need to get back to work to help my colleagues in the support of this effort because there's a lot of stress on our system. And it's that kind of attitude that I see much more prevalently across our system than being broken by the stress that is being created by this pandemic.
Some Valley cities say they need more ambulances right now because of the backlog at emergency rooms, which is creating longer than normal admittance times and keeping ambulances out of service longer than normal. What can you tell us about those backlogs at emergency rooms?
So throughout the healthcare system, there's a natural flow to patients. And when we are at a high capacity, there are going to be certain bottlenecks in the system. I can't speak directly towards ambulances. I do know that our ICUs are operating at a high capacity, and we'd like to move those patients to different levels of care throughout the facility. When we're prepared to discharge patients, there's been a delay in discharging, which is causing another bottleneck. All these nuances to healthcare we are addressing confidently and proactively by looking at the numbers day in and day out to ensure that we can address all those needs for the whole community.
Are there many coronavirus patients coming into the emergency room by ambulance?
There are many patients coming into the emergency room by multiple venues of transportation. Some might include ambulance, but some may be walk-ins as well.
So you're seeing a variety.
Yes.
Dr. McCafferty, does it frustrate you that there are people who still believe that this is being overblown, that this is an exaggeration, that it is just another version of the flu? What do you say to those people?
This is causing a profound challenge to our healthcare systems. This is not unprecedented that we have challenges periodically. It's the sustainment of this COVID pandemic that is creating an additional stress. The love and support that's being provided by our community in general, with signs, with flybys to support our healthcare community is fantastic. And I would urge that in addition to these heartwarming gestures, that people wash their hands, social distance. If you have symptoms, please, please, please don't go to work. Stay at home. Do not go and visit a friend if you have symptoms. We can all work on this together in order to mitigate this pandemic and maintain the health and safety of the entire community.
Do you think we're headed towards another shutdown, and should we be shut down?
So I believe that we will have to constantly take steps as we get new data. In the early phases of this disease, we had to take unprecedented steps for a disease process we didn't really know or understand. At this point in time, we are much more prepared. We know much more about the disease, and the leaders of our healthcare community, the leaders of our country, will probably take the right steps in order to ensure that we can help control this disease.
All right. Anything else you would like to say, Dr. McCafferty?
Again, I'd just like to reiterate the outpouring of support from the community for us is welcomed. It helps us show up to work and work hard in delivering your healthcare across the Coachella Valley. I'd again insist, request, please social distance, wash your hands. If you're symptomatic, stay away from others and quarantine yourself. These efforts will help us get through this pandemic.
Dr. McCafferty, we appreciate your time. Thanks for joining us.
Thank you, sir. I appreciate you having me on today.